Hello friends, welcome you all at Indian Institute of Learning Life Saving Skills. Today we'll be discussing the most important case yesterday we have shared in the group, and there were few queries. So case being young female presented with a generalized body swelling, and we need to evaluate the case as the patient approaches in the OPD. So we must be very judicious while taking the history and doing the clinical examination, and in relevance to that we have to get it done the investigation to support our diagnosis. Okay, we cannot randomly advise all the investigation to the patient, so we must be very cautious. So many things pays off in that. Okay, so most important is when we're talking about a case of generalized body swelling, so what we called that, so generalized body swelling, when we called it as Anasarca. Yes, you have heard rightly, Anasarca is a swelling which is present generalized all over the body, right from your top to the bottom. Okay, second one, when we talk about the swelling at a local place, like I have a small swelling at forearm, arm, or abdomen, or in the thigh. So we need to look for the local causes. Local cause might be sepsis, localized sepsis, not generalized sepsis. Then second one, we called it as some infection, cellulitis, phlebitis, thrombophlebitis, small lymph node, some other things we can consider it of, or some maybe sebaceous cyst, lipoma, infected cyst. These kind of things will be there. So when we talking about the generalized swelling, we have to look for three major causes: heart, liver, kidney. Heart, liver, and kidney. Heart is the most important factor. When ejection fraction drops down, the patient will develop or land up into what? Generalized body swelling. But this swelling will be preceded by the lower limb, that too preceded by the right feet. Always understand, if a patient presented of age of 55 years old presented with a right feet swelling, one-sided right feet swelling, always consider the heart to be taken into consideration while examination, auscultation for murmurs and all. Second, when we talk about the liver, so usually swelling starts from the abdomen, ascites. When we talk about the kidney, renal, so there will be swelling over the face. You will find pre-orbital swelling usually happen early in the morning, or when the patient gets up, and as the day advances, the swelling disappears. So these are the three major things we have to always consider for generalized body swelling: liver, heart, and kidney. Liver, you will find the swelling in the abdomen, that is ascites. Second, kidney, you will find over the face, then it will land up into ascites and lower limb swelling. Okay, this is preceding. If a patient comes with a swelling of more than 2 months of a kidney failure, so there might be swelling over the face, over the abdomen, over the feet. I am talking about the early stage. Early stage means within 1 week, within 2 weeks, when patient approaches to you. So there might be swelling over the feet. It is because of cardiac. When patient comes after 3 months of the CHF, chronic heart failure, or low ejection fraction, there might be swelling in the feet, abdomen, or pleural effusion, these kind of things, because that will be in a chronological order, or the swelling will be increasing. So these are the three most important systemic cause we have to evaluate. So what we have to get in an LFT, ultrasound abdomen, to find out cirrhosis of liver. LFT, you have to look for most important factor. Yes, tell me, comment. So we have to look for most important factor called as total protein level. Yes, total protein level, that too albumin will more produced by the liver. In the renal profile, we have to get it done urea and creatinine. Everybody will consider in RFT urea and creatinine. No, you have to go beyond that. Urea, creatinine, then sodium, potassium, then calcium, uric acid, phosphorus, because all three things are going to change your treatment protocol. Okay, suppose you get it done only urea, creatinine, then you have to look for electrolytes. Again, you will draw the sample, so you have to look for sodium and potassium, because in CKD patients, what happens, they will end up into electrolyte imbalance is more dangerous than the urea and creatinine increased. Okay, then you have to go for phosphorus level, calcium level, uric acid level. These are most important. So always patient, if you are suspecting CKD, always get it done these things: urea, creatinine, sodium, potassium, then your calcium, uric acid, and your phosphorus. These are most important. You have to get it done. So when we talk about you are suspecting any murmur, patient having dyspnea, orthopnea, when lies down, feels the distress, so you have to get it done. You have to get it done 2D echo. Yes, 2D echo is the standard test. Sometimes ECG comes normal. Sometimes electrocardiograph comes normal, but you have to get it done to support your diagnosis. You have to get it done 2D echocardiography. If you are looking for biochemical investigation, you can get it done what? Anti-proBNP. Yes, anti-proBNP. Anti-proBNP is a enzyme. When the heart stretches more, it will increase in the blood. So you can look for that. So these are the three things you have to look. Now one more most important factors which can give rise generalized swelling is the factor which are responsible for maintaining oncotic pressure. Yes, anyone can tell me which protein is most important to maintain the oncotic pressure? So it is your albumin. Yes, very right, you have said rightly. Albumin is the most important factor which is responsible for maintaining your oncotic pressure. So what happens? Oncotic pressure, it helps in, so whenever their patient is having I think one doctor has commented in the group regarding the nephrotic syndrome. Very nice approach there. But you have to look for age group. Yes, age group, pediatric age group, middle age group, or geriatric age group. Nephrotic syndrome even more found in the pediatric age group, sometimes in the adults and middle age group. So what happens? You have to look for urine for albumin. Suppose if urine for albumin spot is more than 3 positive, usually in nephrotic syndrome there will be massive proteinuria. Massive proteinuria means, see, everybody is passing albumin in the urine everyday basis. You do exercise, you have fever, you have stress, you will pass every day. Like me, every normal person will passing. So when it is, that will be either plus 1 plus. So if it is 2 plus, then it is moderate. If it is 3 plus, it is on severe side. But in case of nephrotic syndrome, that is massive proteinuria. Massive proteinuria means protein will be 4 plus. Always remember, albumin will be 4 plus. Then you have to correlate with LFT. In LFT it will be on lower side, that you have to correlate. It will going to disturb your oncotic pressure. Read about oncotic pressure. It is very important when you are dealing case of Anasarca. So you have to get it done that. So in nephrotic syndrome we can diagnose just by urine examination. We can get it done. So these are the few most important causes for generalized body swelling we have to look at it at our OPD basis. There are another n number of secondary level of investigation. These are the first level of investigation. In first level of investigation, you can even get it done your thyroid profile. Sometimes patient will of gross hypothyroidism, there maybe you will find the puffiness of face, then your swelling, these kind of pretibial myxedema, these terms they will designate. And other things what you can look for is, when we talk about there are immune markers are there, that all are secondary level of investigation. If you are not able to find out these investigation like ANA, ANCA level, 24 hours gross, urine, urine they will collect and they will get it done for investigation. So this is most important, you have to get it done. One more thing I wanted to add is ARF and CRF. So why previously they used to tell CRF, chronic renal failure. Now they are telling it is not ARF, they are telling it is AKI, that is acute kidney injury, because acute is reversible. Failure is not reversible, it is exceeding. There is no back care, but in kidney injury there is a back care. So this is how, so that case presented with us, young female of around 32 years, presented with generalized body swelling. So on clinic level, I was not having any blood investigations and all nearby, so I have just got it on sugar level. But their sugar was on lower side. Lower size, it was on 72 or 73. Even after the consumption of food, it was 72. So then I suspected, because in kidney failure patients, what happen? You will find sugar on the lower side. If they are taking any OHA, any insulin, even though if they are landing into CKD, what happens? Their sugar levels will come down to normal even without any drugs. So I have suspected, explained them. Then we have got it done the urea and creatinine, as their financial concern were there, so found to have increased. So next we have to confirm it is by ultrasonography, because ultrasonography will help you to add in the ecotexture of the kidney. Because when we talk about the CRF, there must be a triad. One is what happened? Retention of nitrogenous waste product. Nitrogenous waste product is your urea, creatinine, or blood urea nitrogen. Second one is your, what happens? There will be signs of uremia. Signs of uremia means vomiting, nausea, loss of appetite, feeling drowsy. These kind of things are signs of uremia. Then third protocol is chronic renal osteodystrophy. Chronic or renal osteodystrophy means there will be a change in the size of the kidney. That is most important. CMD alteration, corticomedullary differentiation, that will be altered, you find. and reduced size. Usually it is, you will find into 10 into 8, 12 into 8, that is normal size, but that will be reduced in CRF patients. So that was the case discussion we have shared in the group. So when you are evaluating, so keep all these things in the mind. Rare instances sometimes rarely happen, but they do happen. Okay. So we have to consider these kind of investigation in our clinical examination when we are suspecting a case. So thank you very much. Keep connected with Indian Institute of Learning Life Saving Skills for these kind of health and regular case updates. If any case you find interesting, you can share that. We'll definitely give a point it out and help you in the reaching to the diagnosis. Thank you very much.